My name is Dr. Adrian Cantu. I want to thank Serena and the Fort Worth Hispanic Chamber of Commerce for having me here on their Chamber Conexion so I can provide the presentation of Don't Let Work Give You Pain. I am the owner of Ace Physio and Performance. It is a cash-based physical therapy clinic. It's a little bit different than your traditional brick and mortar insurance-based clinic. What I do is I offer patients one-on-one time strictly with me, so that way they don't have to be shared with other patients. It gives them time to just be spent with their direct provider, and it allows me to give them the best care that they need. So what I'm going to do is talk to you a little bit about Don't Let Work Give You Pain. The objectives for today are give some poor work posture examples, talk about some proper work site setup, and a few exercises y'all can do in order to help with any issues you might be facing. So just a little bit more about me and my clinic. We do specialize in returning weekend warriors to their competitive sports without pain medication, injections, or surgery. You can follow me on Instagram at AcePhysPerform. Okay, so there I am. There's my Instagram tag right there. And for the most part, that can be used for my LinkedIn, Facebook. So if you want to find out some more about me, what I do is I offer information through all of those websites, whether it be blogs, or video content, just to describe some exercises that people might be able to do in order to help out with some issues they may be facing. So I chose this picture here as a poor work posture example because it shows several instances of how we tend to sit and do our work, especially if we're on our computers continuously. So as you can see, this lady has a desk that's a little bit too high for her. And I'll go into how to correct these things on the next slide. But as you can see, she's a little bit elevated through her elbows, so she's bringing her shoulders up like so. She's having to bring her head forward in order to look down at her computer, which isn't ideal because that can lead to some neck pain, some back pain. As you can see also, the chair itself, it doesn't look like it has any kind of back support, which is something that is going to give you some low back pain if you don't have anything for that. It also doesn't have any kind of arm rests, so that's another thing that you might want to consider. As you can see, she is using a laptop. So when we use a laptop, we typically don't have any kind of ergonomic assistance. And I'll talk about some of those things that we can use as well in order to help these issues. Let's go on to the proper work site setup. So as I mentioned, desk height is one of the biggest things that is hard to adjust, okay? Because a desk height can either be too tall or too short. Some things we can modify simply based off of the chair that we have. If it's able to elevate or lower, that can modify it. So say, for example, the desk is too tall for you. For a person that's a little bit shorter, what will happen is they're gonna have to scoot towards the front of their chair. So when they do that, they're not gonna be able to have that lumbar support that they need for their back, which can lead to that low back pain. They're having to lean more forward. They're having to put their feet on the floor, which instead of being at that nice 90 degree angle, think of a square, the way it should be whenever our back is against that chair, our hips are going to be lower than 90, and then our knees are going to be greater than 90 as well. So that can give us potentially some hip issues, not so much some knee issues, but it just sets us up for poor posturing and some more pain, especially in our low back. So some things that you can do when it comes to a desk height is make sure to adjust the chair. So you want it to where your hips and knees are at 90 degrees. If the desk height is not able to be modified with an elevating stand or lowering stand, then you want to make sure to use a footrest. Now, the chair, as you can see in this example, it doesn't have any kind of elbow rests. So as I mentioned earlier, when we don't have that elbow rest, what happens is our shoulders just tend to sag down. And in order for us to combat that, what we have to do is we tend to pull up our shoulders like so. Well, a lot of times people tend to carry their stress through their shoulders. Well, and they're thinking, well, why am I doing that? As Serena's nodding, yep. So one of those things can be because you don't have that elbow support whenever you're working on your computer. So if you have that elbow support to where you're able to rest your elbows on those arm rests, your shoulders aren't being depressed and lengthened through here. You're able to keep your elbows at 90 degrees as well, and whenever you're working on your work site. Now, the monitor plays a huge role as well. As you can see, this monitor itself would probably be a little too large for a typical person in that chair. When you are setting up your work site, you want to make sure, first off, you're all the way back in your chair. And when you stick your arm out, that is as far as the monitor is from you. At the same time, the way the monitor is set up, the height of it needs to be adjusted. So when you're sitting up nice and tall and you're looking straight ahead, the top of your monitor should be at eye level or below. A lot of times people will have it higher up, and what they're doing is they're constantly having to do this motion. And when they're doing that, what's happening is these muscles back here are having to be overactive, and that can give you some neck pain. Okay, so if you're constantly doing this throughout the day, yes, you didn't think you might have been doing much, but over time it is going to affect you. You also want to make sure that the monitor is directly in front of you. Okay, a lot of times people will have it off to the side, so they'll be looking at it like so, doing their typical work. Well, if you're constantly looking at one way or the other, then once again, some muscles are going to be overactive, leading to some imbalances and can lead to some of that pain just because they're doing more than they want to be doing. Our body, for the most part, just wants to be left alone. It's our job to keep it moving and keep it optimal so that way we don't have that pain. Let's talk about the mouse and keyboard a little bit. So when I mentioned ergonomics earlier, there are some ergonomic assistants that you can use. So this here is a wrist pad that you can place in front of your keyboard. So that's something that you want to make sure to use, so that way your wrists aren't going into extension like so, and that can lead to carpal tunnel. We don't want you to have carpal tunnel. As y'all know, that can be very detrimental. It can lead to some kind of numbness or tingling in the hands. You can feel that throughout the day or at night. So all you have to do is just get a little pad off Amazon or any store, just set that right in front of your keyboard, and that'll help out your wrists. As well as your mouse, you can get a mouse pad that has a little bit of wrist support too. Okay, so you can see here, I'm able to rest my wrist on this without it once again being in that extension position like so. Now, personally, I'm not a fan of traditional mouse setup. I prefer a trackball setup to where I'm just using my thumb to move my mouse instead of actually using my wrist to navigate around wherever I'm looking. Because once again, if you can take away any kind of potential stimuli that can lead to damage, we want to do that. So that's why I just use these simple ergonomic things that are fairly cheap, and they can help you out in the long run when it comes to not having pain in your wrists, in your back, in your neck. Mentioning the back as well, I have a little lumbar support here, as you can see. So that gives me some curvature to my spine support. So that way I'm not just slouching down like this throughout the day or leaning forward in that position. That way you can sit up tall. You want to make sure that you are putting yourself in an optimal position whenever you're going to be in a position for a long time. And then finally, let's talk about the phone. Whenever you're setting up your work site, you want to make sure that your phone is once again at arm's length away from you. You don't want to have to be reaching constantly for it one way or the other. Just if you're going to be using it constantly, have it close to you to where you can just grab it and get on the phone. Now, depending on if you spend a lot of time on the phone or just quick calls, you want to make sure if you are going to be on the phone a lot that you have some sort of headset. So that way you're not just holding the phone like this, and then that can lead to some neck pain down the road as well. Okay, so you want to make sure that you're just making it easier on your body, especially if you're going to be in these positions for hours at a time. Now, especially right now, we've all been doing Zoom meetings more. We've been working from home more. Our home work site doesn't tend to be the best setup compared to work. However, work site setup as well doesn't always have an ergonomic assessment to it either. It's just, here's a desk, do whatever you want with it, and that's what people do. Well, by making these minor adjustments to your work site, this can potentially lead to a decrease in any kind of risk of harm to your body and keep you healthy and pain-free. So next, what I'm going to do are show you some exercises that can potentially help some issues that we face. Okay, so 3 exercises that I chose to kind of help our general whole body, okay? And by all means, y'all are welcome to join me. I'm going to demonstrate them to y'all so that way you have an idea of what they are. Because if I were to show you this and not show you, you're like, okay, I don't know what the heck I'm doing. So the first one, I call it chicken wing, and that's just based off of how we position ourselves. So the end position is like this, Okay, so what I'm doing with my hands is I'm placing them on the sides of my spine. So as you can see right there. Now, and it's at the bottom of your neck and where your mid-spine join together. So you're right there. Now from this position, your arms come forward and then you open up. And you try to open up and you're trying to push your spine forward at the same time. So what this is trying to help with is trying to eliminate that forward head posture that we get by being on our computers, on our phones, pretty much anything that we do these days, we tend to be in this forward posture. So if we can help out our upper spine and lower cervical spine by going into this position, you're getting into that extension, which we don't tend to do throughout our day. We tend to be more in a flexion bias. Something to keep in mind is when you go into that open position, you might feel a pop. If you do, it's perfectly fine as long as it's not painful. Sometimes it's just some air bubbles popping, just like when you crack your knuckles, nothing to worry about. So that's for your lower cervical and your mid-spine exercise. Now with that exercise, it's just kind of a feel-good one. You're just doing some mobilizations. You can do 20, 30 of those. So the next exercise, seated rotation. So same thing, and just stay seated in your chair. You just give yourself a little hug. And what you're doing, keeping your feet firmly planted on the floor, you're going to turn as far as you can, hold that for a couple of seconds, and then same thing the other way, and hold that for a couple of seconds. Now, you might feel that going one way or the other is a little bit harder, or you can't go as far, and that's natural. We tend to be direction biased simply because if we're right side or left side dominant, or if we played sports when we were younger, you're going to have those more limitations compared to side, and that's okay. But the thing is that you're actually moving your spine is the benefit, because naturally as we age, our mid-spine, our thoracic spine, we don't tend to do any kind of rotation movements. So by actually getting yourself into doing rotation, what we're accomplishing are several things. So yes, we are doing a rotation moment with our spine here. So when we rotate, what's happening here is we're also getting a forward motion and a backward motion on the opposite side. So what that's simulating is as if we're doing either a flexion or an extension moment, but one-sided by getting that rotation. So that's kind of for your mid-spine. And then the last one I chose for squats for your exercise, simply because if we are constantly sitting at our desk for hours at a time, we do need to get up. Now, yes, you are sitting and standing throughout the day, but it's not an actual squat. And just doing maybe 10 squats, you get up to go get something from the copier, or you go into your kitchen if we're now at home doing these Zoom meetings. Just do 10 squats while you're at your desk. So that way you're strengthening your legs at the same time. Now, something to keep in mind when you're doing your squats is you want to make sure that your knees aren't going inwards together. Okay, you want to make sure that your knees are in line with your hips, they're in line with your ankles. Okay, that's the biggest thing, because if your knees are constantly going inwards when you're going into that squat position, well, that tells you a few things. One, that you do have some weakness in your hips, and two, that you're having to compensate by getting that stability of your knees touching to help you sit or stand. Well, I don't know about you, but I'd rather not have to have a total knee replacement or a total hip replacement in the future, simply by just making yourself more conscious and more aware of how you move throughout your day. Our bodies are great at moving and getting whatever task you give it accomplished. You tell it to do something, it's going to do it. It might not be the prettiest, but it'll get it done. It's just as if you were to use a screwdriver when it would have been better to use a Phillips head. Kind of the same thing. It's going to get it done. It might not be the prettiest, but it'll get done. So simple little tweaks to exercises play a role. Form plays a role because, like I said, our body does want to cheat. So just kind of staying on top of that to where we're not cheating as much. But these are 3 exercises that I chose for y'all to help out throughout the day, just simply because based off of how we are when we're here sitting at a desk in front of our Zoom meetings, or if you're at work. This just gives you, doesn't even take 5 minutes to do these 3 exercises, about 20 repetitions of the chicken wing, 20 repetitions turning side to side, and 10 squats, not even 5 minutes, and that'll get you moving. So in conclusion, don't let your pain get any worse. So schedule your free total body screen today. So I offer a 20-minute free total body screen to anybody, whether that is yourself, friends, family. That is a free 20 minutes with me. Ask me whatever you want about your body. I'll take a look at you, see how you move, see if there's things that we can work on, and we can come up with a game plan.
Ace Physio and Performance, specializing in returning weekend warriors to their competitive sports without pain medication, injections, or surgery.